Hello. Next, I'd like to speak about electrical injuries. Here's a sign of someone being shocked, and that's what happens. People fall to the ground. Electrical injury is defined as either low voltage or high voltage. Low voltage, I'll give you a little aside here. Medical people in the medical literature define low voltage as anything less than 1,000 volts. If you read the literature of electricians, they define high voltage as anything over 500 volts. The difference is the physicians aren't the ones getting shocked. For step 2, we're going to define low voltage for your testing as anything under 600 volts, and anything above that is high voltage. Okay, so 600 is the cutoff between low and high. All right. Electricity flows through the path of least resistance. So when you're exposed to electricity, it will go through areas where there's low resistance. The lowest resistance tissues in the body are what? Well, the electricity is preferentially going to go through the blood vessels, all that nice electrolyte solution in the blood vessels. It's going to go through the nerves. It's going to go through the muscle. Then it's least likely to go through areas of higher resistance, which is dry skin, the fat, the tendon, the bone. So this tells you right away what organ systems are most likely to be damaged when electricity goes through the body. The parts that are going to be damaged are the parts where the most electricity flows through and releases its energy and causes a thermal burn. And we all know that if you're wet and exposed to electricity, that causes very low resistance and increases the amount of energy absorbed from the electric current and increases the damage to the tissue. Well, there's about 17,000 folks with electrical injuries a year, so it's likely to be a question or two on your board exam. And about half the deaths are from low voltage, half are from high voltage. The low voltage in the standard house is 120 volts. This is very unusual to cause any arrhythmia or any injury. Usually injuries and death occur from the 220 volts up to the 600 volts in the low voltage range. Electricity can cause injury from burns, just from the contact. It also causes a fire to occur on any clothes that the patient has on. And don't forget that when the muscles are exposed to electricity, they contract violently. And even blunt trauma, even fractured bones from sustained, vigorous contraction of the muscles can occur. AC or DC, does it matter which you're shocked with? AC current is more prone to leave you with ventricular fibrillation, all right? AC low voltage. And DC or AC high voltage is more prone to leave you with asystole. Does it really matter? No. You're going to treat the ventricular fibrillation or asystole by the protocols that we discussed earlier under pulseless, how to treat patients without a pulse. All right? So to recap, to review, 120 volts, that's normal household current, is unlikely to cause any arrhythmia or serious problem. High voltage injuries, electric lines, this is very dangerous. Many patients have loss of consciousness. The thermal injury of electricity going through the nerves also often causes brain damage, can damage the spinal cord and cause quadriplegia. The ensuing asystole or ventricular fibrillation leads to hypoxic encephalopathy, and many of these patients never quite return to normal and have subtle personality changes and mental status changes. As the electricity goes through the vascular tree, it thromboses arteries, causing stroke, heart attack, and pulseless extremities. It could also weaken the blood vessel to cause aneurysmal dilatation, which can lead to subsequent rupture later. We talked about very strong muscular contraction that can lead to fractured to fractured bones, and shoulder dislocation is very common in this situation, actually. Look at the skin. They'll tell you on the test questions that there might be flash burns or arc burns or thermal burns. And if they tell you at all in a test question, even if there's a tiny little wound, if someone got shocked with their finger, there could be a tiny little wound here. But if they had their other hand on a piece of metal bar, the electricity is going to go through the heart, might cause extensive damage to the cardiovascular system, extensive muscle damage with myelonecrosis leading to rhabdomyolysis. But the little entrance and exit wound can look very puny and innocuous. So don't let a very small external wound make you feel comfortable that there's not a serious involvement underneath the skin. Of course, the standard treatments for rhabdomyolysis will apply with maintaining adequate hydration and preventing hyperkalemia with alkalinizing the urine. Getting hit with large electric shock, including lightning, can lead to delayed cataract formation. And again, with the tentanic contraction of the diaphragm and the muscles of the chest wall, these people are unable to breathe. They're unable to relax their diaphragm and their chest wall musculature. Okay, so who's at risk for low voltage injuries? It's 220 volts and above. It's people that are wet, have wet skin at the time of the accident. It's people that tell you they're stuck on the electrical current. And it's people that have an entrance wound on one hand and an exit on the other. If the electrical current crosses the chest, you're more likely, of course, then to damage the electrical system of the heart. All right, so how do you treat these folks? Well, there's really nothing particularly special, unique to the electric. First, you have to rescue them from the electric shock. Try to turn the electricity off, all right? Don't try to just grab them because then you'll get electrocuted also. And it's the standard airway breathing circulation like everybody, all right? You'll probably need IV fluids on these patients, and you will need to consider treatment for rhabdomyolysis with the bicarb, all right? Treat any arrhythmia or any burns, external burns, the way you would treat any other arrhythmia or burn case. Who stays in the hospital with electrical injuries? Well, the main thing is depending on what their symptoms are. If someone is having an arrhythmia, they need to be observed. If they're dysmic, they need to be observed. In other words, if they have abnormal vital signs, if they're having chest pain, they need to be watched in the hospital. Patients with 120 volts, that low voltage stuff, they generally need not to stay. They almost never need to stay in the hospital. The high voltage, they almost always need to stay in the hospital, especially if the current has transversed the chest. Pay a special attention for looking for compartment syndromes and pulseless extremities. Since thrombosis in the blood vessels are common, it could lead to a pulseless arm with an acute arterial occlusion. Similarly, the increased swelling in the compartments of the extremities can lead to a compartment syndrome, also leading to pulselessness and pallor and pain and paresthesia and paralysis of the affected extremity. There's one special case of the child that bites the electric cord, an extension cord. And when the child bites the cord, there's a flash and there's a burn right at the corner of the mouth. And the key on this case, they give you this case, is even though there's no active bleeding now, as this wound remodels and starts to heal, the labial artery was injured and will start to have significant bleeding days after the incident. So what you want to do in this case is you want to talk to the parents about this possibility, and before that's going to happen, you're going to do an urgent referral to the appropriate oral surgeon or plastic surgeon to repair the damage. Lightning. There are several hundred deaths from lightning a year. Lightning is super high voltage, okay? And the burns tend to be superficial, and it kind of has like a ferning, branching pattern on the skin. Death is frequently from, the apnea, from the tentanic contractions of the diaphragm and the chest musculature. Of course, asystole and VFib is very much is commonly induced. Also, the blast itself, these lightning people, in addition to be electrocuted, also you should think of them as multiple trauma victims. They're frequently thrown, they have blunt force head trauma, fractured neck, long bone fractures. So it's a blast, it's an explosion in addition to an electric shock. That is the end of electrical injuries.